To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today's topic is the rotator cuff. To help us through it is Dr. Delo from Delo Sports Medicine. Hi, doctor.
Hi.
Let's get right into it. Let's explain what the rotator cuff is.
Sure. So the rotator cuff is a group of muscle tendon units that help stabilize the shoulder. We say the shoulder is a golf ball on a tee instead of a ball and socket joint. So the muscles and tendons of the rotator cuff wrap around that ball and help stabilize an otherwise unstable structure.
Got it. And it seems like there's a ton of injuries in rotator cuff. Is that true?
Yes, it is the most common cause for patients going to the doctor with shoulder pain.
So help me understand this. It's not always just a tear. I could have a rotator cuff problem that isn't a tear, or it could be a tear.
Correct. There's a full spectrum of injuries, usually to the tendon. Starts with tendinosis, which we used to call tendinitis, which is just wear and tear or overuse of the tendon causing pain. And then there is partial tears, which can also be treated conservatively, as well as a condition called impingement, where patients only have pain when they pinch that rotator cuff between the bones, like with elevation of the arm or internal rotation. And then finally, there are complete ruptures, which are often from falls. And those are definitively surgical because the tendon is pulled away from the bone and would need to be reattached. Yeah,
and that's pretty straightforward. That happens, you need surgery. But what about some of the more conservative approaches to a non-major injury there? What do we do?
Right, all those other rotator cuff conditions can be treated conservatively typically, which the most important part, of course, being upfront therapeutic exercise to optimize the function of all the muscles around the shoulder so there isn't as much stress on the rotator cuff. And then usually we'll treat pain with anti-inflammatory medicines or some type of injectable.
Well, let's get into the types of injectable. We all understand physical therapy first, but then what do you do? What kind of injections do you do to cure that?
So historically, we've done a lot of cortisone, and shoulder specialists have really started to speak out against that because we know it increases the risk of rupture to the tendon as well as decreases the surgical outcomes for future surgeries. So really we try not to use that if possible. Sometimes we'll use Toradol, which is an Advil type relative, as a rescue if patients need pain control. We're seeing a lot of evidence now for PRP in the rotator cuff, both for better pain control long term, as well as hopefully some improvement in the quality and function of that tissue.
And all to get us to heal a little bit better without surgery, right?
Ideally.
Yeah, ideally. All right, doctor. Well, thanks for kind of leading us down the rotator cuff rabbit hole, and we know a lot more. So thank you for that, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.